I presented this year at EHA the result of the first 11 patients of the TL-895 201 study, which is an open-label multi-center phase 2 study investigating the efficacy and safety of the TL-895 in monotherapy for patients with myelofibrosis. And the main results were that so first, at the time of data cutoff, 91% of the patients were still alive, and the median overall survival was not reached at a median follow-up of 15.4 months. Regarding the secondary endpoints at week 24, it's worth noting that 36% of the patients had achieved a TSS50 response by MF-SAF, and TSS responses were found to improve over time, with the best overall response for 55% of the patients occurring beyond week 24. Regarding the spleen volume, and no patient achieved the NSVR 35 response at week 24. However, we have seen very encouraging improvements in the spleen volume over time, past week 24. But the most interesting result was on the platelet counts. Indeed, 55% of the patients achieved the platelet response, reporting a greater than or equal to 50% improvement in their platelet count from screening, and an absolute count of greater than or equal to 50 Gauge per liter with responses lasting at least 8 weeks. And 27% of the patients achieved a greater than or equal to 100% platelet increase, which was never seen. And which was very important is that this platelet changes was sustained, and this improvement was sustained over time. And regarding safety, the most common all-grade adverse event were anemia and thrombocytopenia, knowing that most of these patients presented thrombocytopenia and anemia at diagnosis and before entering the clinical trial. So very encouraging results in these patients with severe thrombocytopenia, with an excellent safety, excellent tolerability, which opened the way to a randomized double-blind placebo-controlled phase 2b study for this TL-895 drug. We are planning that trial.